Have you ever listened to your own body as you get out of a chair? Not just with your ears, but with your full attention. First, there is the mental preparation, the conscious decision that it's time to stand. Then the lean forward, the push with the hands, and then the sound. The symphony of snaps, creaks, and groans that seems to echo through the room. It is often accompanied by a sharp, grabbing pain in the knee, or a deep, grinding ache in the hip. For a moment, you have to stand perfectly still, waiting for the pain to subside, waiting for the joint to settle in, before you can take that first, tentative step. This small, everyday action, the simple act of standing up, has become a monumental effort, a negotiation with pain. This experience, in countless variations, is the silent reality for millions. The world, which once felt expansive and full of possibilities, begins to shrink. The long walks in the park are replaced by short, careful trips to the mailbox. The joy of playing with grandchildren on the floor is overshadowed by the fear of not being able to get back up. Stairs become a dreaded enemy. We are told by well-meaning friends, family, and sometimes even by doctors, that this is simply the price of a long life. It is wear and tear. It is arthritis. It is an unavoidable part of getting older, and the best we can do is manage it with pills, injections, or brace ourselves for the eventual joint replacement surgery. Today, we are here to challenge that narrative. We are here to tell you that while some age-related changes in our joints are normal, chronic, debilitating pain is not a mandatory life sentence. The problem, in so many cases, is not that our joints are simply worn out beyond repair. The problem is that the entire support system around them, our muscles, our ligaments, our patterns of movement, has been neglected. We have been taught to fear pain, to rest it, to immobilize it. But in doing so, we have inadvertently been starving our joints of the very thing they need most to heal and thrive: gentle, intelligent, and consistent movement. This is not about pushing through excruciating pain. It is about learning to move in a way that nourishes your cartilage, strengthens your supporting muscles, and flushes out the inflammation that is the true source of your suffering. Today, we will embark on a journey to reclaim your freedom of movement. We will expose the myths that have kept you in a cycle of pain and inactivity, and we will give you a series of simple, safe, and profoundly effective movements that you can do in the comfort of your own home to begin quieting the pain in your knees and hips, starting today. To truly understand how to heal our joints, we must first understand why they hurt. Let's demystify the knee and the hip. Think of your knee as a beautiful, sophisticated hinge. Its primary job is to bend and straighten. It's cushioned by cartilage, a smooth, rubbery substance that allows the bones to glide over each other without friction. The entire joint is enclosed in a capsule filled with a remarkable substance called synovial fluid. This fluid is your body's own natural lubricating oil. It nourishes the cartilage, which has no direct blood supply of its own, and keeps the hinge moving smoothly. Your hip, on the other hand, is a ball and socket joint. This design allows for a wonderful range of motion: forward, backward, sideways, and in rotation. Like the knee, it is lined with cartilage and lubricated by synovial fluid. The crucial thing to understand about both of these joints is that they do not exist in isolation. They are at the mercy of the muscles that surround and control them. The knee has the powerful quadriceps in the front of the thigh and the hamstrings in the back. The hip is controlled by a complex network of muscles, including the glutes in the back, the hip flexors in the front, and the adductors and abductors on the sides. Here is the source of so much of our pain. Over a lifetime, we develop profound muscular imbalances. We sit for long periods, which causes our hip flexors to become short and tight, and our glute muscles to become weak and dormant. It's a condition often called gluteal amnesia. Your brain literally forgets how to fire these powerful muscles effectively. When your glutes are weak, other muscles have to pick up the slack. Your hamstrings and lower back become overworked. This imbalance pulls on your pelvis and changes the entire alignment of your legs. Now that ball and socket joint in your hip is no longer moving in its optimal, centered position. There is friction. There is rubbing. There is irritation. The same story applies to the knee. If the muscles on one side of your thigh are tighter or stronger than the muscles on the other, it can pull your kneecap slightly out of its natural groove. Every time you bend and straighten your leg, the kneecap grinds against the bone instead of gliding smoothly. This creates inflammation, wears down the cartilage, and sends screaming pain signals to your brain. So often, the knee or the hip is simply the victim. It is the site of the pain, but not the source of the problem. The problem lies in the weak, tight, and imbalanced muscles surrounding it. This is incredibly hopeful news. Why? Because while you may not be able to regrow cartilage, you absolutely have the power to strengthen weak muscles and lengthen tight ones. You have the power to restore balance to your body, and in doing so, to take the pressure and strain off of your aching joints. The second piece of the puzzle is understanding inflammation. When you hear the word inflammation, you might think it's always a bad thing. But acute inflammation is a vital part of your body's healing process. If you sprain your ankle, the swelling and redness is a sign that your body is sending a flood of healing resources to the area. The problem is chronic inflammation. This is a low-grade, simmering fire that never gets put out. It can be caused by a poor diet, high stress, lack of sleep, and critically, by the constant irritation within a poorly aligned joint. This chronic inflammation breaks down cartilage over time and makes the nerve endings in the area exquisitely sensitive. This is why your joints can ache even when you're not moving, and why they can feel so stiff in the morning. Here is the miracle of movement. Gentle movement acts as a powerful, natural anti-inflammatory. When you move a joint through its range of motion, you are acting as a pump for that synovial fluid. You are pushing out the old, waste-laden fluid and drawing in a fresh, nutrient-rich supply. You are literally lubricating your own joints from the inside. This movement also increases blood flow to the surrounding muscles, bringing oxygen and healing nutrients while carrying away inflammatory byproducts. And finally, when you strengthen the muscles around the joint, you create a strong, stable scaffold. This muscular corset supports the joint, absorbs shock, and ensures that it moves in its proper alignment, preventing the friction that causes the inflammation in the first place. The movements we are about to learn are not just exercises. They are a form of medicine. They are a way to communicate with your body, to tell it to calm down, to lubricate, to strengthen, and to heal. Before we begin a single movement, we must establish the most important rule. Listen to your body with kindness and respect. We are not here to fight with our bodies. We are here to partner with them. This means we will operate on a green light, yellow light, red light system. Green light means you feel a gentle stretch or the sensation of a muscle working, with no significant pain. This is our goal. Yellow light means you feel some discomfort, a slight ache, or a pinching sensation. This is a sign to be cautious. You should immediately reduce the range of motion, make the movement smaller, or back off entirely. Red light means you feel any sharp, stabbing, or shooting pain. A red light is an absolute stop sign. It means your body is telling you that this particular movement, in this particular way, is not right for you today. There is no prize for pushing through pain. The only prize is consistent, pain-free practice that leads to long-term relief. It is also essential that you consult with your doctor or a physical therapist before beginning this or any new exercise program, especially if you have had a recent injury or surgery. The information we are sharing is for educational purposes and is designed to be safe and gentle, but your personal health provider knows your specific condition best. Now find a sturdy, stable chair, preferably one without arms, and place it in an area with some space around it. Wear comfortable clothing that allows you to move freely. And let's begin our journey, not with a movement of the legs, but with a movement of the breath. Sit comfortably in your chair, with your feet flat on the floor, and your spine tall but relaxed. Place one hand on your chest and the other on your belly. For the next minute, simply notice your breath without trying to change it. Now we will begin to practice diaphragmatic, or belly breathing. As you inhale through your nose, I want you to feel your belly expand and push out against your hand. Your chest should remain relatively still. As you exhale slowly through your mouth, feel your belly gently fall back towards your spine. Let's do this together. A slow, deep inhale, filling the belly with air, and a long, slow exhale, releasing the air completely. When we are in chronic pain, our nervous system is often stuck in a high alert, fight or flight state. This type of slow, deep breathing is a direct signal to your nervous system that you are safe. It helps to lower stress hormones, relax muscle tension, and bring a fresh supply of oxygen to your tissues. This is the foundation upon which all our other movements will be built. Practice this for 2 minutes before every session. Now that we have calmed our nervous system, let's begin with the simplest and most important movement for lubricating our joints. We will start from a seated position. Sit tall in your chair, towards the front edge, ensuring your feet are flat on the floor. Our first movement is the heel slide. Extend one leg out in front of you, with your heel resting on the floor. Now very slowly, as if you are dragging your heel through thick mud, slide your heel back towards the chair, bending your knee. Only go as far as is comfortable. Then just as slowly, slide your heel forward again to the starting position. That is 1 repetition. The focus here is on slow, controlled movement. You are gently pumping that synovial fluid into the knee joint. This is not about how far you can bend your knee. It is about the quality of the movement. Perform 8 to 10 slow repetitions on one leg, and then switch to the other. This is a perfect warm-up and a wonderful exercise to do anytime your knee feels stiff. Next, we will work on activating the primary muscle that stabilizes your kneecap, the quadriceps. Still seated tall, place your hands on the sides of the chair for support. Straighten one leg out in front of you, parallel to the floor, or as high as you can comfortably go. As you do this, consciously squeeze the large muscle on the front of your thigh. Hold this contraction for a count of 3, 2, 1, and then slowly lower your foot back to the floor. This is the seated leg extension. The key is the squeeze at the top. You are waking up this muscle and reminding it of its job to support your knee. If you find it difficult to lift the whole leg, you can simply straighten your knee as much as you can while keeping your heel on the floor, and focus on that muscle squeeze. Perform 8 repetitions on each leg. Now let's bring some gentle movement to the hip joint. We'll start with the seated march. Sit tall, with your feet hip-width apart. Slowly, lift one knee up towards the ceiling, as if you are marching in place while sitting. Only lift it a few inches off the floor, keeping the movement small and controlled. Then slowly lower it back down and lift the other knee. The goal is not to see how high you can lift your knee, which can sometimes pinch the hip. The goal is to gently activate the hip flexor muscles and bring some movement to the ball and socket joint. Continue this gentle marching motion for about 30 seconds, keeping your upper body still and your core engaged. To address the muscles on the outside of the hips, which are crucial for stability when you walk, we will do a seated clamshell. Remain seated, but bring your knees and feet together. You can place your hands on the outside of your knees. Now, while keeping your feet together on the floor, gently press your knees outward, opening them like a clamshell. You should feel the muscles on the sides of your hips and buttocks engage. Hold this outward press for a moment, and then slowly bring your knees back together. This movement directly targets the gluteus medius, a muscle that is often weak and contributes to both hip and knee pain. Perform 10 to 12 slow and controlled repetitions. This completes our gentle, seated warm-up series. You have lubricated your knees, activated your quadriceps, and brought gentle motion to your hips in several directions. This sequence alone, performed daily, can make a significant difference in your levels of stiffness and pain. It is the perfect starting point. When you feel comfortable with these movements, and they are consistently in your green light zone, you can progress to our next series of exercises, which will be performed standing, using your sturdy chair for support. Place your chair in front of you and stand behind it, holding onto the back for balance. Your feet should be about hip-width apart. Before we move, let's focus on posture. Imagine a string pulling the crown of your head up towards the ceiling. Your shoulders should be relaxed, and your weight should be evenly distributed between both feet. Our first standing movement is designed to awaken the most important muscles for hip and knee health, your glutes. This is the standing glute squeeze. Simply stand tall and consciously squeeze your buttock muscles together. Hold the squeeze for a count of 5, as if you are trying to crack a walnut between them, and then relax. You are not moving anything else, just isolating and firing those powerful muscles. Do this 10 times. This simple act helps to re-establish the connection between your brain and your glutes, reminding them to participate in your daily movements. Now let's build on that. From the same standing position, holding the chair for support, we will perform a standing hip extension. Shift your weight slightly onto one leg. With the other leg, keeping it straight, slowly lift it straight back behind you. The movement should be very small, only a few inches. The key is to initiate the movement by squeezing the glute muscle of the lifting leg. Do not arch your back. The work should come entirely from your hip. Hold for a moment at the back, and then slowly lower the leg back down. This is a direct way to strengthen the gluteus maximus, which will take a tremendous amount of strain off your lower back and knees. Perform 8 to 10 repetitions on each leg. Next, we will target those side hip muscles again, which are so important for preventing your knee from collapsing inward when you walk. This is the standing hip abduction. Standing tall and holding the chair. Shift your weight onto one leg. With the other leg, keeping it straight, slowly lift it out to the side. Again, the movement is small and controlled. Do not lean your torso to the opposite side. The work should be isolated to the hip. Imagine you are trying to push a wall away with the side of your foot. Slowly lower the leg back down. Perform 8 to 10 repetitions on each leg. You are building a powerful, stable base of support for your entire lower body. Now we come to one of the most important functional movements for daily life. The sit to stand, or the chair squat. Stand in front of your chair, with your feet shoulder width apart, and your toes pointing slightly outward. You can hold onto the back of another chair in front of you for balance if needed. Begin the movement by sending your hips backward, as if you are about to sit down. Keep your chest up and your back straight. Lower yourself down only a few inches, making sure your knees are tracking in line with your toes and not going past them. Then push through your heels and squeeze your glutes to stand back up tall. This is a mini squat. The focus is on the hip hinge motion. This strengthens your glutes and quads in a coordinated, functional way. If this feels comfortable, you can progress to lowering yourself until you lightly tap the chair with your bottom, and then immediately stand back up. Perform 8 to 12 repetitions. This single exercise, when done correctly, can transform your ability to get up from any chair with confidence and less pain. After we have worked on strengthening the muscles, it is equally important to work on lengthening the ones that have become tight. A flexible, pliable muscle is a healthy muscle. We will perform all our stretches gently, without bouncing. We will hold each stretch for 20 to 30 seconds, breathing deeply into it. Our first stretch will target the hamstrings, the muscles on the back of your thigh, which often become very tight from sitting. Sit on the edge of your chair. Extend one leg straight out in front of you, with your heel on the floor, and your toes pointing up. Keep your other foot flat on the floor with the knee bent. Now, keeping your back perfectly straight, slowly hinge forward at your hips until you feel a gentle stretch along the back of your straight leg. Do not round your back. The movement comes from the hips. Hold this position and breathe. Then slowly come up and switch sides. Next, we will stretch the hip flexors, the muscles on the front of your hip that become so tight from sitting. Stand next to your chair, holding on for support. Take a small step back with one leg. Now, keeping your back straight, gently bend your front knee and press your hips slightly forward. You should feel a gentle stretch along the front of the hip of your back leg. Make sure you are not arching your back. You can increase the stretch by tucking your tailbone under slightly and squeezing the glute of the back leg. Hold this gentle stretch, and then switch sides. Releasing these tight muscles can often provide immediate relief to both lower back and hip pain. To stretch the powerful glute and piriformis muscles deep in your hip, we will do a seated figure 4 stretch. Sit tall in your chair. Cross one ankle over the